This PowerPoint will describe the very basic outline of health insurance in the United States, which is a very complicated topic. Basically, health insurance is an arrangement with a company that will help protect you from the high costs of healthcare. And it works by spreading the cost among a large group of people so that basically everybody's paying in and you might end up helping to pay for the care of other people. Some years you might pay more in premiums than the cost of the services that you use, but in other years you might have very high healthcare costs, and then the services that you use, those costs will be higher than what you've paid in. And we see health insurance as a way to improve access to healthcare services among Americans. People are more likely to get health care services if they have health insurance. Usually, health insurance in the US means medical insurance, and it covers the costs of doctors, hospitals, x-rays, lab tests, medications, other treatments. But interestingly, there's two body parts that health insurance does not cover, which are your teeth and your eyes. And I have no idea why, but you have to have separate insurance for your teeth. That's called dental insurance. And you have separate insurance for your eyes if your vision is poor and you need glasses. So it would cover your eyes if you had some health problem where you needed some kind of surgery, but it wouldn't cover just getting a prescription for glasses or contact lenses. So in the United States, if you have all three types of health insurance, so medical, dental, and vision, people say, wow, you're really lucky, because a lot of people, even if they have health insurance, they don't have dental or vision insurance. In the United States, most part-time workers do not get health insurance benefits from their employer. And part-time is working less than 30 hours a week. So in one study, only 21% of employees had an offer of insurance, which usually even means that you have to pay for part of it or all of it yourself. And so 21% were offered, but of that, only 56 participated. So really, according to the study, only 11% of part-time workers have employer-sponsored health insurance. The premium is the amount that you pay or your employer pays or the government pays each month to cover the cost of the insurance. The average monthly premium for a very basic health insurance plan, not dental, not vision, is about $440 a month for an individual, and for a family is $1,200. This would be if you paid for the whole policy yourself. Obviously, it depends on where you live and the details of the plan. This data was from 2018. So who does pay the cost of those health insurance premiums? It could be the government, it could be your employer, it could be you, or it could be some combination of the above, which is the most common scenario in the United States. So the government has two main programs where they actually pay the cost of your health insurance. One is called Medicare, and that is for everyone who's age 65 or older in the United States, regardless of your income, whether you're rich or poor or middle income. Medicare will cover, again, your basic health care costs once you are age 65. It also covers some people with disabilities. Then we have another program that in the whole country is called Medicaid, and in California it's called Medi-Cal. It's the same program, and this is for people who qualify because of their income. They are low income of any age, right? And especially the funding is there to help children under age 18, pregnant women, and people with disabilities. Sometimes your employer will pay, and this is private sector or public sector employer, some employers will pay the full cost of the premium for you and your dependents. Your dependents are your family, so your husband or your wife and your kids. Some employers will pay the premium for you, the worker, but then you have to pay the additional premium to make sure that your spouse and your kids are covered. And some employers require a copay. So they pay part of the premium and you pay the other part of the premium. Usually it's between $150 and $300 a month. So remember, the full cost just for you would be $450. So your employers are paying some of it. And this is a pre-tax deduction from your paycheck. Then another possibility is that you and the government share the cost. And you might have heard of Obamacare. The official name for Obamacare is the Affordable Care Act. An act is a law. This was passed by the U.S. Congress, the federal government. And it said that you must have health insurance, and we're going to help you pay for it if your employer doesn't provide it. So Covered California is our state, what we call an exchange, where you can go and look at health insurance plans that are offered by private companies that the state has approved to sell these plans. So if your income is high, you would pay the full cost of the plan. If your income is low or moderate, you will get what's called a subsidy, which means that the government pays part, they pay the subsidy, and then you pay part. And if you go to this exchange, then the main types of plans that you can choose from are called PPOs, or Preferred Provider Organizations, or HMO, Health Maintenance Organization. This is, again, a very basic comparison of the plans. In general, HMOs are more affordable, the premiums are lower, but you'll usually get less coverage and you'll have some more restrictions on what is covered. PPOs in general are more flexible. They provide greater coverage, but you will pay more. You will pay a higher premium, you will pay a higher deductible, you will pay a higher copay. Here's a little chart that has some of the comparisons. So the benefits of a health maintenance organization are lower premiums and low or no deductible. And the benefits of a PPO is you don't have to see a primary care physician before you see a specialist. And usually you can go out of network, even if they don't pay for everything, you can see a doctor that's not part of the PPO. But the cons of the PPO, higher premiums, usually have a deductible. The cons of the HMO are that you have to select a primary care physician, and you often need a referral to see a specialist. And you can get emergency care wherever you go. But if it's not an emergency, usually you'll have to pay for everything yourself if you're outside of what is called your network of providers. Okay, so we talked about a premium, which is what you pay every month just to get the insurance, no matter if you're sick or healthy. A deductible is the amount that you have to spend every year before the insurance company pays anything. So a higher deductible is bad for you, a low deductible is good. A low deductible means, after you spend $500, the insurance company will cover. A high deductible means you might have to spend $1,000 or $2,000 or $5,000, the whole amount yourself, before the insurance company pays anything. So we have an example of John. He has a health plan, but it has a $1,000 annual deductible. Unfortunately, John fell off his roof and was injured, and he had to have 3 knee surgeries in 1 year. So the first surgery is $800. He has not spent any money on healthcare that year, so he has to pay the full $800 because he hasn't used up his deductible. Okay, so he pays the full $800. Then John also has something called co-insurance. So even after he's spent his $1,000 on the deductible, he still has to pay a percentage of the healthcare cost. This is more common in a PPO than an HMO. So poor John, he has to have another surgery. His surgery cost $3,200, but he's already paid the $800, so then he pays $200. and then his deductible is met. After that, he will only pay 20% and the carrier will pay 80%. So the remaining surgery is $3,000. He pays 80%. The carrier pays 80%, $2,400, and John pays 20%, $600. Okay, so he has to pay a total of $800 for that surgery. And here's a little chart. Here's his first surgery. Because he hasn't met his deductible, the first surgery is $800. He pays 100% of that. The second surgery is $3,200, so he pays the first $200, and then of that $3,000, John pays $600, and the insurance company or the carrier pays $2,400. And then John has to have another surgery. And this is where we get to a concept called the out-of-pocket maximum, OOPM. This is the most that you will pay for all of your healthcare costs during a year, except for the premium. So the goal of the out-of-pocket maximum is to protect you from very high medical expenses. So if you were really sick and had to go to the ICU for a week, it could easily be $100,000 or $200,000. So your out-of-pocket maximum means you will never have to pay more than whatever that amount is. It's often something like $5,000 or $10,000. So after you reach that out-of-pocket maximum, your health insurance or your plan begins to pay 100% of the allowed amount for covered healthcare services for the rest of the year. And then at the beginning of the next year, you start again. So it's $5,000 maximum per year. Sometimes they don't count all of your out-of-pocket expenses. Sometimes they don't count your deductible. So we're going to continue with poor John because he needs to get his third surgery, and his third surgery is $8,000. So he doesn't have to worry about the deductible, but he does need to pay the co-insurance on the surgery up to his out-of-pocket maximum is $3,000. So he's already spent $1,600 so far, and now he needs to spend another $1,400, and then he's done. Once he's hit the out-of-pocket maximum, his plan covers the remaining costs. So his co-insurance for the third surgery is $1,400. That's the 20% co-insurance cost. And then the plan, his health insurance carrier, will cover the $6,600. So let's see this. So John's first surgery, he pays $800. Second surgery, he pays $200 plus $600. That's another $800. And then the third surgery, he pays $1,400. And then he's done for the year. He's hit his $3,000 out-of-pocket maximum. If he has any other healthcare costs, whether it's $100 or $1,000 or $100,000 in that year, his insurance company will pay all of the covered costs. Okay, getting back to, this is a new concept, which is a copay. Not co-insurance, but a copay. A copay is a fixed amount that you pay for a covered healthcare service, usually right when you get it. So you might have already paid this, right? You are maybe familiar with this concept. So you go in to see the doctor because your daughter has a sore throat. Normally it would cost $200, but you only pay $15 because that's what the copay is. So whether the doctor charges $100 or $150 or $200, your copay is the same, okay? And then your healthcare plan would pay the rest of it. So this again is a very basic summary of how health insurance works in the United States. If you feel confused, you are not alone. It is very confusing to Americans as well. It's a lot of vocabulary for us to understand as well. So I hope this has been